Hey guys, Elite Clinical Research Group here. Today we're going to be talking about what is needed to break into the clinical research field. As many of you guys probably know by now, breaking into the clinical research field is no easy task. It requires a lot of hard work, a lot of dedication, a lot of follow-up, a lot of sweat, and a lot of tears. Just because you may have a big fancy degree, a master's in public health, a master's in clinical research, a MD even, or a dentist degree, or whatever advanced degree you might have, you may think that you are entitled to a position in clinical research, but that could not be further from the truth. This is an industry just like every other industry, and just because you have a degree, an advanced degree in that industry, does not mean you know exactly how to do the job. Knowing how to do the job is what is of primary importance in this field, and employers really value someone who can come in and provide instant value and impact, just like in every other field. So you need to be able to have instant value and impact in order to be successful in your job search. And today we're going to be talking about how you can provide that. So one of the areas that recruiters and hiring managers look at, obviously, is your education. So one of the things they're going to look at is what degree. Did you go to college? What did you study in college? So you may think clinical research, that may require a science background like biology or chemistry, and that certainly may help, but for all of you other people who may have majored in business or finance or psychology or any of the other humanities, don't think because you majored in there that you can't get into clinical research. Because at the end of the day, what they really care about is experience. And we'll talk about that in our second point. But it definitely helps if you have a degree because you can forego some of that other experience. You'll see on the job applications, they'll say, blah, 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 blah. We're looking for somebody who has a college degree for the entry level position, a college degree, or someone who has 2 years of experience in clinical research without a college degree. So even if you don't have a college degree, there's ways to get into this field. There's ways to get into this field and start getting experience and move up in this field even without a college degree. So don't be discouraged if you don't have a college degree. I know someone, for example, who doesn't have a degree but is a CRA. So I'm sure there's other people out there like that as well. The second and most important way to get into clinical research is your experience. What previous experience do you have in clinical research? Did you work in a lab? Did you do bench research while you were in college, or was that your job after you got out of college? Did you do bench research? Have you had any other pharma experience? Did you work in the manufacturing sector, or did you work for any pharma companies? That certainly helps too. Or have you worked in the CRO industry before? Maybe you were on the more business side, or maybe you're on the sales side of things, but you want to transition over to the more clinical side of things. That definitely helps. So any way you can get in and get some experience in pharma or the CRO space definitely helps getting into the clinical research part of the business. I would say bench research and manufacturing are two of the most common experiences I see on people's resumes when it comes to trying to break into clinical research. So those two are always good options, but any pharma research experience or any bench research experience or just any experience in that sector is beneficial. I would say the second most important part, besides having actual clinical research experience, is what marketable skills do you possess? Do you have experience taking meeting minutes? Because there's a lot of meetings that happen in clinical research and someone has to keep track of what is talked about. So do you have meeting minutes experience? Do you have experience using Excel spreadsheets? There's a lot of a lot of things that are kept track of with on Excel spreadsheets, and you need to know how to navigate around that. Do you have experience writing lots of emails and using Microsoft Outlook? They have these technical skills at the bottom of your guys' resumes, and these are often overlooked, but these are vastly important because you're going to be using these throughout your career in clinical research. Every day, all day, you're going to be writing emails to people, so you need to be able to know how to write a good email. And this is something that the recruiters will see when you are responding back and forth with them, and the hiring managers when you're talking back and forth with them. How are your communication skills? Not just written, but verbal as well. How are you over the phone? Are you comfortable and confident, cool and collected when you're talking on the phone? So these are skills that you want to make sure are good when you're trying to get over into the clinical research space. Maybe do you have any experience with GCP ICH guidelines? Have you had to research those before, or have you just done some research on your own? That's definitely something to keep in mind. Do you have any experience with data management, data analysis, and data tracking? These are all very important things that recruiters and hiring managers are looking for in the clinical research space. Since this industry is very remote, that means that everything is on the computer. Everything has to be kept track of. There's lots of data to be kept track of. Do you have the ability to maintain that data, keep track of it, analyze it if necessary? Those are very important skills to have on your resume and highlight if you can, if those are in your past jobs. So if you're in lab, if you were doing bench research in a lab and you had to keep track of your findings, that's something to definitely keep track of on your resume and highlight, because that's a very important skill in the clinical research space. So to summarize, we talked about three main things that you've got to have in order to break into the clinical research space. That is education. What education level do you have? Don't be discouraged if you don't have a college degree, but it certainly helps. And it doesn't exactly matter what college degree you have, whether it's science or business or psychology or anything humanities related, it doesn't matter. You can find skills in your previous work that will apply and be positive attributes in the clinical research space. Second, and most importantly, research experience. What previous research experience or pharma experience do you have? They like people that have lots of experience analyzing and maintaining and tracking data, but still you can highlight some of your other positive experience, and that should be good enough as well, just as long as you highlight it in a good way. But data analysis and tracking is a really strong one that I've seen work for a lot of people. So if you have that in your previous jobs or your previous work experience, please make sure that you highlight that. And last, what about your other marketable skills that you've been working on and practicing throughout the life of your professional career? Your email and communication skills. Make sure those are up to par, because you're going to be using that day in and day out. Make sure that do you have experience with ICH, GCP? Have you worked with that in your past, or have you just looked it up on the computer? Make sure that's noted, that you have knowledge about that. Do you speak another language? Huge positive attribute and marketable skill that you can add to your resume, because this is a global industry. We talk with people and deal with people of all walks of life from all over the world. So if you speak multiple languages, that's a huge asset for any clinical research organization or pharma company. So make sure you keep those in line on your resume and have those highlighted throughout. All right, guys, thank you so much for watching this video. Go ahead and like it and share with all your friends in the clinical research space. Comment down below if you have any positive criticisms to say, or you just want to show some love on this video. Don't forget to hit that red subscribe button down below, and we'll see you guys next time. Take care.